Earth, Wind, and Fire, effects of air and water on the cardiovascular system. So I'm going to touch on air pollution today. So air pollution, why is it important? Well, we all breathe air. And so it's very important to understand how our air affects our bodies. I think in the past, we've always understood that air affects our lungs. So we have lung issues and asthma associated with that, but it affects other organ systems as well, and particularly the heart. It affects for heart attacks, which we've talked about, strokes, different arrhythmias, congestive heart failure, and a multitude more. And it's kind of obvious that, it's everywhere. There's pollution throughout our universe. There's natural pollution from wildfires. There's cities with industry and factories. There's airplanes and car pollution. And so it's really throughout, and it's only getting worse. The statistics, I think mine are maybe a little bit more dated, but I found statistics that said that 7 million people are prematurely affected by air pollution, and about half of those are affecting the heart. So 3.5 million people suffer from cardiovascular disease that they wouldn't otherwise have if there wasn't this degree of air pollution. It is a World Health Organization epidemic. 25% of deaths are from heart disease, and another 24% from stroke. So one of the early studies that I was able to find is kind of interesting. It's from 2005, if you can believe that was one of the earlier studies, but it's linking the freeway pollution in Los Angeles by zip code with cardiovascular disease. And so this looked at residents in Los Angeles that were over age 40, and it showed that when they had high levels of this particulate matter, 2.5, that you had increased deposits of plaquing in your arteries. And so this one looked at our carotid arteries as a marker of disease, but the association existed despite gender differences, age, and being on lipid-lowering therapies. So they found that there was quite a connection between the air pollution surrounding our freeways and our risks of disease. So just to give you a framework, because it's in a lot of the research studies that I'm going to talk about, these arteries up here are your, These are your carotid arteries. This is the normal innermost lining of your carotid artery, and the subtlety of the plumping of the lining is there. And just to give you a frame of reference, this is what plaque looks like as it deposits in our arteries. And so what we're talking about is kind of real early plaquing. And it's really easy to come by because you can just put an ultrasound probe on the carotid artery and look to see if there are deposits there. So if we dial back to the key pollutants, we're looking at these different pollutants in terms of particulate matter and gases, so solids and gases. And the PM 2.5 is that really fine particulate matter that Dr. Robert Gopalan had talked about already. And that is the stuff that's most strongly linked with cardiovascular disease. The larger particles are still important. Those are things that are in pollen and dust. And then there's the gases, there's the nitrogen dioxide, ozone, and sulfur dioxide, as well as carbon monoxide that can contribute to different disease states. So the mechanism of action of this is really kind of interesting because it hits through 3 different pathways. There's your inflammatory response. So once the irritant gets into the system, there we go. It causes a cascade of different pathogens to be irritating. It can cause the blood vessels to constrict. It can cause some irritation in the endothelial linings, and you can cause a lot of different variabilities in terms of blood pressures. You can also have this neuroendocrine dysfunction, which activates stress hormones. So those things can raise your blood pressure and your heart rate and can contribute to different arrhythmias. And then there's this interesting pathway, the pollutant translocation, where your body actually absorbs some of these chemicals directly, and it induces a vascular injury. So just hearkening back, we know that the PM 2.5 are very, very damaging, but the way that they come into the system is very unique. And so we see that there are the normal pathways that we're familiar with, where this is lung tissue taking in the particulate matter compounds, and it goes across the membranes into the capillaries through inflammatory markers. That's a little bit more of what we're used to. But the understanding that a particle could perhaps get through the lining of the lung into the capillary directly is this translocation pathway, and it's somewhat unique. And we have seen it, this is on a microscopic view to look at the particulate matter just going right into the blood vessels in the capillaries directly. So it can cause that immediate interaction in the body. Well, this process is something that we know in cardiovascular disease, because this is what we see with atherosclerosis. You have particulate matter come in, the body starts to see it deposit within the blood vessel. Over time, you form a much more substantial narrowing or blockage within the artery. And then these other inflammatory agents come along and over time can cause disruption and can cause that fibrous cap to break off, and that is where we see heart attacks. So if we just shift our attention to some tissue damage, not just on a cellular level, but actually within the tissue, you can see that this is filtered air is right here, and the tissue is much more uniform. It looks to be more healthy tissue, but as you start to have dirtier air along the way, you see deposits of amyloid plaque, macrophages, and other damaging elements to the tissue. So you start to disrupt the internal membranes of the tissue, and that's also where there is a lot of dysfunction and irritation. And if we just go back a little bit more in terms of a macro level, this was an interesting research study looking at coronary calcium deposits within your heart arteries that are from different levels of PM 2.5 within 6 different cities. This is the PM 2.5. This is Los Angeles. I know it's like microscopic for you all, but there is a red amount of PM2 in Los Angeles, and this is the nitrogen dioxide, a bit more in New York City than Los Angeles, but still quite a bit of red. And those populations that have these high levels of PM 2.5 and the nitrogen dioxide have higher amounts of deposits in their patient's coronary calcium than those that don't have that. So we've got to put this all together. We've got cellular mechanisms that are disruptive. We've got tissue mechanisms that are damaging. We've got coronary plaque. Well, how does this all come together so that we can understand what does the air pollution do to our bodies? So this is a research study looking at patients in Canada over the course of 10 years, and it looked at whether air pollution and hospitalizations for cardiovascular disease. And it showed that in circumstances where the PM 2.5 and the nitrogen dioxide levels were, again, very high, those correlated with acute cardiac hospitalizations. They saw this most significantly in elderly patients as well as women, particularly in the extremes of temperature, very, very cold or very, very hot. There's also some gender differences seen, and this was a short-term exposure. So these were people that were just hit with some sort of like acute event that caused air pollution in the area. It looks at ozone, nitrogen dioxide, as well as the PM 2.5. And it showed that women did have higher risks of not only cardiovascular death, but they also had higher risks of stroke associated with ozone. And then just to look at kids, I thought this was somewhat provocative because it looked at that plumping of the innermost lining of kids' carotid arteries. So kids that were 7 to 15-year-olds should not have plaquing noted in their carotid arteries. But within this study in Ecuador, looking at these kids that were exposed to traffic exposure, they did have increased plumping of that innermost lining. In Taiwan, a similar study looking at 12 to 30-year-olds after they had these similar exposures had a plumping of that innermost lining. So we can see that even with kids that have a lot of these mechanisms within their body to cause protection, we're still having damage to their arteries. There was one study looking at prenatal exposures. So for pregnant women that were exposed to high levels of ozone, they also had plumping of their kids, their unborn children's IMT, and they felt that that was somewhat related to DNA methylation, which we talked about a little bit last year. So this is a study that we're going to get into a little bit later because we have one of the authors of this study, but this is from Dr. Tan out of Cedars-Sinai. He examined the hospitalizations for patients out of the wildfires from LA last year. And you could see, perhaps not surprisingly, that for respiratory infections, there was a spike in the ER visits and hospitalizations after the wildfires. There was a spike in heart attacks after the wildfires. But interestingly, this study showed that there were all these chemistry abnormalities within the blood. And so we'll talk about what that actually means for patients that are exposed to the wildfires. Is it a more systemic response? Are there other multi-system disorders occurring? So that's going to be something that we talk about a little bit more later. So this seems like a disaster. Like, how do we fix this? This is not looking great. Well, we want to show that there are things that you can do about it. And so, in an effort to try to stay safe, we know that there are certain apps that you can look at that will give you a better understanding of what your air quality is. So this is one, there are a lot, so I'm not advertising this one, but that you can look up your city by city and or zip code, and it'll give you a score. And it'll tell you where your risk of is associated with that. And it also will give you a map of what things look like in your area. And then it gives the pollutants. So if you're worried about what your PM 2.5 is or what your ozone levels are in the area, it'll also give you a little bit of a prompt to say, well, maybe this is a day where if you're somebody at risk, you should not be outside as much, or wear a mask if it's something that you're an at-risk patient. HEPA filters. So these are the high efficiency particulate air filters. These remove about 99% of all these very small particles. So having them nearby you, either at work or in your home, is going to be extremely effective at removing all this particulate matter. And this study showed, it was looking at endpoints of blood pressure and heart rate variability, but it showed a very profound response to being able to get that particulate matter out of your air. Masks. We learned a lot about masks during COVID. And so we know that this is these are the fabric masks, which are good to block some, usually droplet protection, but surgical masks have an additional layer, and you can block some fine droplets. But if you really want to block the PM 2.5, some of the ozone, you're going to need the KN95, the N95, as well as respirators. So to be heart healthy, this is something that has been a central focus for everything that we've talked about for the past 13 years. There is no substitute for healthy living. To eat healthy, to exercise, those are going to be things that combat the effects of some of these deleterious effects of air pollution. So having regular checks with your doctor, seeing how much plaque burden you have, understanding, are you at risk for having hypertension? Those are some of the primary things that you can do to protect your heart. And it really does make a huge difference. There were some research studies in China looking at 13,000 patients that were of risk for cardiovascular disease, and it looked at these different risk factors: smoking, drinking, amount of sleep, what your BMI was, what your physical activity is, and as well as how do you cook your food with electricity versus coal. And if you had on the lower spectrum of any of these things, even if you changed them after being identified with a risk of cardiovascular disease, it correlated with reduction in cardiovascular events. So even just making some small changes can improve your cardiovascular health. And if you think that you are vulnerable, there are a million different ways that you can look at your vulnerability and to see what your life expectancy will be. And so I just was using this to highlight that on the coastal areas, you could see we have a lot of low vulnerability. So we're very healthy out here. And if you are right around Pacific Heart Institute, you will live for a very long time. So in conclusion, air pollution leads to premature cardiovascular disease in about 7 million people. Particulate matter, particularly the PM 2.5, is a major culprit leading to cardiovascular disease. Environmental toxins, including PM 2.5, lead to an inflammatory response, a neuroendocrine response, and translocation. Women and children are affected more than our male counterparts, and when in an affected area, N95 masks as well as HEPA filters can help filter dangerous particulate matter, and having a heart-healthy lifestyle can combat the effects of air pollution. All right.